Welcome viewers, welcome friends, welcome colleagues to MuniMeterHealth, your source of learning cardiology and about human heart. I'm Dr. Jaitly from New York, your cardiologist. We are clearly advancing on medical education, patient education, one step at a time through our videos in order to improve the clinical outcomes and thereby the patient health literacy. And we have seen that clearly that this is directly proportional. The moment you can actually narrow the gap between the medical education which the doctors in the community have and in the general community, the patient education that the general masses have. Once you narrow that gap, the clinical outcomes are certainly going to improve. Well, welcome again. This is Dr. Jaitly on MuniMeterHealth. In this short video, I'm going to be briefly talking to you about what is the latest indication in the device called Mitral Clip. Now, I don't know whether you have heard of Mitral Clip or not, but this was a device which was approved in 2013, in the year 2013, and it looks something like this. Here, I've drawn it in the structure here for you already, and essentially, it's almost like a clip which goes through the femoral vein insertion. So let's understand that first. And obviously, it's a non-invasive technique where through the femoral vein, the catheter is advanced, and it obviously comes into the right atrium, and that's where the puncture occurs in the interatrial septum, and the device is now advanced into the mitral orifice and then later on dropped into the left ventricle, if you will. Once it's here in the left ventricle, we know that in patients who have heart failure or congestive heart failure, we write it down here, the left ventricle has failed. Obviously, it has remodeled, it has hypertrophied, it has dilated and eccentrically dilated, I should say. As a result, the mitral valve is deformed. So the mitral valve being deformed, it results into a mitral regurgitation. So we have increased, we can show it in a slightly different mosaic pattern here. This is mitral regurgitation that is occurring. As a result, the blood is going back into the left atrium. Now that results into the shortness of breath. It results in obviously swelling over the feet or the legs and what have you. So these patients are markedly dyspneic on exertion, or they have shortness of breath and swelling over the legs as a result of mitral regurgitation, which is now backing up the blood flow into the left atrium and into the pulmonary veins or into the lungs, if you will. Excuse me. So the whole idea is we knew that for heart failure patients, mitral regurgitation, which is here, I'm showing it in different colors here, mitral regurgitation was always present in these patients in moderate or whether in severe amount. Now, whether it was related to degenerative disorder, like mitral valve prolapse, or whether it was rheumatic in origin, we knew, or sometimes even a normal secondary, we call it secondary functional mitral regurgitation that occurs because of the remodeling, as I just showed you within the mitral apparatus here, if you will. So heart failure patients in general, it was like, I would say it's a negative spiral. They went into pathophysiology, if you understand, that the heart failure patients, once they started, for whatever reasons, that they were cardiomyopathic, the muscle was weak, either it's after a viral infection, or it could be a cardiomyopathy from a diabetic or a hypertensive burnt out phase, or it was related to coronary artery disease or myocardial infarctions. The heart failure that ensued results into a mitral regurgitation because of the mitral valve, and the increased mitral regurgitation as it worsened caused more heart failure. So it was a negative vicious cycle, if you will, constantly playing here. So along came the therapy where you could actually use vasodilators. So we were using the ACE inhibitors in these patients. We are using the ARBs, obviously. We are using vasodilators and diuretics. And all of these drugs are immensely helpful in these patients. Needless to say that along came the other devices called the cardiac resynchronization therapy, which is CRT, or the implantable cardioverter defibrillator, ICD as we call it. So all of these devices, they resulted into optimization of the heart failure patients. So all these things were already in effect. Then in 2013, mitral clip was approved by the FDA. The FDA approved it and said that you could use a mitral clip by putting this clip non-invasively, just by a small puncture within the femoral vein, and that's in the groin. Okay, so there is no open heart surgery involved. There is no stenotomy. There is no sawing of the breastbones. And here you are, a patient is in a cardiac cath lab. Under fluoroscopy, the mitral clip is advanced and dropped into the left ventricle till these mitral valve tip leaflets, if you will, I can show them here, they are clipped and the clip sits here. So as a result, now you have the mitral regurgitation which was occurring is now minimized, and as a result the mitral clip stays in place. So that was an indication that was approved in year 2013 for all moderate to severe mitral regurgitations, as I'm showing you in the right side of the panel, but with abnormal valves only. So heart failure with moderate to severe mitral regurgitation was already approved in year 2013 for abnormal valves or degenerative valves or any other etiology of the valves other than the normal valves. Now in year 2019, FDA has taken a new step following a New England Journal article which was only published in September of 2018. And the authors are clearly involved with plus 70 university sites in America and Canada. The lead article was from New York Cornell, where I trained, so I'm proud to say that. New York Presbyterian, Columbia, Columbia Presbyterian Medical Center, Ohio, and of course Baylor, and many others, Baylor from Texas. So all of these centers, they were involved in enrolling about 700 patients, and these patients were taken into two arms, one with optimal therapy, this is your optimal maximized therapy right here, and the other were the device therapy. And the device therapy, these two patients, they performed differently. They were followed for 24 months, and they found that there was lesser rehospitalization and lesser deaths in the device arm, and that was concluded in this article in New England Journal of September 2018 that was published, where they found that the mitral clip, if was placed in addition to the patients who were already getting the optimized guidelined therapy for heart failure, those patients who received the device, they had a better outcome in terms of rehospitalization, if you will. I'll quickly write it down here. And then, of course, the death rate, the mortality was also reduced. And all these patients were studied for about 24 months. So these patients, the rehospitalization and the mortality rate was reduced in this arm of device, where the device was being placed. So the conclusion of this article was clear that you can reduce the rehospitalization by almost 35% and the mortality by 30%, which was a big number because you're saving these patients and they're living longer beyond 24 months, beyond 2 years, especially when they have heart failure and secondary mitral regurgitation. They followed that the patients who were receiving this, regardless of what the etiology of the mitral regurgitation was, whether it was even a normal valve which has a secondary mitral regurgitation, even they fared very, very well with the hospitalization rate and the mortality rate. So FDA just only last month, I got news for you, FDA only last month approved of a new clear indication for a mitral clip to be indicated for patients who have heart failure and who have maximized optimal medical therapy, again on the right side of the panel I'm showing, but even for normal valves. 2013, mind you, heart failure with moderate to severe mitral regurgitation. Mitral clip was indicated for abnormal valves. But now even for normal valves, now it is indicating as long as there is a secondary significant mitral regurgitation, which we call moderate or moderately severe mitral regurgitation. So folks, mitral clip is now widened its indication. We know that there are about 7 million patients. We have 7 million patients alone in the US at any time, per year as a prevalence of these heart failure patients. However, only a small percentage of these patients have mitral regurgitation of a significant nature. But and it's needless to say that those are the patients now that can qualify for a mitral clip. Now remember that there are certain contraindications, and a relative or an absolute contraindication is if one cannot use in patients who have a contraindication for anticoagulation, say somebody who has bleeding tendencies or cannot. So those patients are clearly not indicated. There are certain adverse effects you have to really also understand. Like every device that you place internally comes in with a price, obviously. One is the bleeding tendencies because of anticoagulation involved. Stroke that can happen because of the thrombi that can form as a result of inadequate anticoagulation, which is again true with all devices, intracardiac devices. Atrial fibrillation, a new onset atrial fibrillation can develop here. Endocarditis, again prone for infections, and death. So these are some of the adverse effects from placing a mitral clip in a setting of heart failure patient, just so that you know. So I think we have covered in a very small video here the new indication I call it for mitral clip device, and it is something very, very catchy now. And again, I'm thankful that New York Cornell was the leading investigator, along with 65 or 70 other sites across the North America, including Canada. And as a result, that we have concluded that now, even for normal valves which have secondary mitral regurgitation of moderate to significant severe variety in a heart failure setting after optimization of complete guideline therapy, including CRT and or ICD, those patients can still qualify for mitral clip, as we have clearly shown the rehospitalization and the mortality rates both are lowered in these patients at the end of 2 years. Okay, and again, the survival, survival with risk-free and event-free with mitral clip has been shown for over 10 years, so that is pretty good. So in fact, it's been around for that long. However, the indications were only established in 2013 and 2019 now, which is only this year. Okay, so looking forward to meeting you again. We always give you the cutting edge cardiology as well. And again, I hope this was very helpful. So next time when the patients, if you're a patient and you're wanting to know about your family member or somebody else, when you go out and discuss with your physician, be sure you bring up the discussion of mitral clip, or if they do bring up the discussion of mitral clip device, you will be in a better position to know exactly what's going on. And of course, if you're a student taking an exam, a fellow taking an exam, a board exam, I'm sure you have a better grasp now what mitral clip is about and where are the indications. These are the most current indications. There might be a question on the boards, by the way, on this, and I do expect at least one question on mitral clip device with a new indication now, even for normal valves. Now it's being placed where you have significant secondary mitral regurgitation in a setting of heart failure. Looking forward to meeting you again. This is Dr. Jaitly again from New York, your cardiologist on MuniMeterHealth. Please watch and continue to share. And of course, if you like this video, do not forget to press the like button. Thank you and so long. See you again.